Good morning, Facebook. I'm Sabirah Rayford with WPTV, and we are joined right now here virtually and live on Facebook with Dr. Susan Lehmann. Susan specializes in seniors' mental health, geriatric psychiatry at Johns Hopkins University. Susan, just tell us a little bit about your background.
Sure. Hi. Thank you so much for having me, Sabirah. I'm really delighted to be here today. So I am a geriatric psychiatrist, and that means that I have not only completed medical school and done a residency training in psychiatry, but also done additional training in geriatric psychiatry, which is focused on the mental health needs and problems that affect people, older adults. The question often comes up, what is geriatrics? Who's old? Probably, I would say anybody over the age of 65 and up till over 100. We have so many people these days, living to be centenarians. And so my interest has really been on the clinical care, improving clinical care, diagnosis, and help those seniors and their families to live their best lives, as well as to help educate and train the next generation of people like me, as well as general physicians who will be caring for older adults.
Let's talk a little bit about geriatric mental health. You just mentioned right there a great point as to who's actually considered in that realm. We know there's a lot of elders and seniors, so and who qualifies for that. But on a serious note, COVID-19, when we talk about seniors and their mental health, what were some things you were seeing as this pandemic began, and where are we at now?
Okay. Well, as you know, COVID-19 is really probably the biggest public health challenge of, I would say, our generation, but certainly it's the biggest public health generation of the century that we're facing. And this pandemic has disproportionately affected seniors. We know that older adults are increased risks of complications if they're to get the virus. We know, unfortunately, they are at increased risk for mortality and death. In fact, nearly 80% of the COVID-19 deaths in our country are among older adults over the age of 65. We know that older adults living in certain situations, such as nursing homes, have really been disproportionately affected. And seniors living in the community have been disproportionately affected. Those who live in retirement communities, assisted living, and those who live independently by themselves with spouses or adult children. So their social lives have been drastically impacted. And there have been quite a few mental health challenges that we've been seeing. I think certainly in the beginning and even now, a lot of anxiety, a lot of natural worry about the virus, a lot of concerns about sadness and depression, missing out on family events. But we've also worried a lot about the impact of social isolation, because from a public health standpoint, the right thing to do is for there to be social distancing, or I would say the better term is physical distancing. But that means that many older people are really spending more time alone and are not as connected with their families as they used to.
You know, Dr. Lehmann, I want to jump in because you mentioned another great point. And once again, for anyone watching right now, please feel free to submit questions. I mean, this woman is an expert. She's very humble, but she's very well versed in this field. And like I said, she is practicing at Johns Hopkins University and teaches and lectures there. But Dr. Lehmann, tell us the difference between social distancing and physical distancing. You said that last time in our interview. Talk about the connection there and why that's so important.
Okay, yeah, absolutely. Well, from a public health standpoint, I'm not saying anything that's new. Everyone has heard it at this point. The importance, in order to prevent the spread of the virus, that we talk about the importance of social distancing. I'd rather use the term physical distancing, because what that really means is you want to be at least 6 feet away from other people. You want to be wearing masks. It's very important that that also includes not participating in gatherings, and depending on your community, your state, and where you are. These are constantly changing in terms of the public health directives, how many people can be indoors, what numbers of people and percentages who can be in outdoor situations. So from a public health standpoint, there's no question that physical distancing is absolutely crucial to get a handle on the virus, prevent its spread, and really protect lives and protect the lives of our seniors who are so vulnerable were they to get sick. However, it comes at a cost because even before this pandemic started, we've had lots of years of data and many studies that have indicated that when people feel socially isolated and they feel that it increases loneliness, and that itself can have negative mental health impacts, particularly on older people.
Well, we're getting a couple of questions coming in, so I want to get to those. And really, this is really a great opportunity for us to just have this important conversation. And we're focusing on seniors today, but we've been talking about mental health for everyone. I mean, obviously, this impacted everyone. Tell us a little bit about what you're going to be doing this week and talk about that partnership and this exciting free Zoom virtual event you have coming up. Let's talk about that and then we'll get to some questions.
Okay, well, I'm very excited. I think this a week from today in the evening, I will be giving a public health, a public talk on Zoom, I think. If it weren't the pandemic, I'd be coming to your community in person, but I will be there in spirit. I'll be there virtually. And really, the focus of the talk is going to be, exactly on this, on this important and really relevant subject, which is what are the challenges during COVID-19 on the mental health for seniors, and how can we sustain a positive mental well-being for ourselves if we're seniors and for our aging family members if we're concerned about that. And I'll be talking a little bit as I'm talking about with you about what the challenges have been, what we're seeing, how we're seeing it evolve over the past 9 months, and what do we know? And I think there is some emerging guidance that it's not just completely common sense, but some emerging guidance about coping strategies that can be useful, as well as how do we deal with this paradox of we need to do physical distancing, but how can we stay socially connected despite the need for physical distancing?
Exactly, and that's presented through the Ruth and Norman Wells Jewish Family Services based right here in Boca Raton. Usually, like you said, you come here and you're able to meet with everyone in person. Obviously, 2020 makes that extremely difficult. So once again, it's through the Ruth and Norman Wells Jewish Family Services. And that is a free virtual event. We're going to have a lot of information for you on our website, WPTV.com. But let's get to some of these questions. We're getting a few coming in. So first, someone asked just a simple one. What can you do to help someone, a loved one that's elderly in care homes? So someone who's currently in a group home or care facility, but you're also at home, quarantining.
I think the most important thing to do, to talk about, is maintaining communication. This might be something I'll come back to multiple times, which is really find as many ways available to you to stay in communication with your loved one. Now, for those who can have access to FaceTime or potentially to email and are comfortable with these kinds of technology, that's great. But I wouldn't discount even just talking by phone and the value of keeping in touch with someone by phone on a regular basis. Let them know you're thinking about them, ask how they are, keep them up to date with the family. I think that's really so important, is to have good communication and stay in touch as much as possible. And where somebody is in a facility where you can have contact with the nursing staff, keep in touch with the nurses. See if you can get maybe if there's the name of a particular person that you can call and ask how your loved one is doing. I found for myself, I have a number of patients I continue to see who are in assisted living, and they themselves don't have access to a smartphone, but I'm able to connect with them through an aide or through a nurse who uses a smartphone for me to be able to see my patient and talk with my patient. This is also possible for families as well.
It sounds like technology has been a big help in this pandemic with keeping people connected and can be a great resource. I mean, hey, we're using it right now to talk to all our friends on Facebook.
Exactly. I have to say, this honestly is the amazing thing about our times. Here we are hit with this really incredible and challenging pandemic. And so many times people are making analogies to the 1918 flu pandemic, which also hit the entire world. But 1918, there was no technology. 1918, there weren't even telephones, much less smartphones, much less computers like this. And so what a difference. And thank goodness we have it, because it really does help compensate.
Excellent point, Dr. Lehmann. Now I want to get to another question, and we'll see if you can answer this. Someone said, are you noticing cognitive abilities declining as the geriatric cohort is having less outlets to stimulate their brains?
That's a wonderful question. And we certainly are concerned about that. I would say for some people, yes. I would say yes. For some people, I think some families are noticing that they're concerned about the loved one having less social stimulation. And this, unfortunately, is being noticed more in settings such as nursing homes, where a lot of the activities that were fantastic for patients have had to be set aside. The groups, the activities, the physical exercises that were happening, the arts and crafts, a lot of them are not happening. And so there's fewer things for the older person to engage in. I would say my seniors who are living more independently and are comfortable with technology, a lot of them are thriving because there has been a huge number of online opportunities. And if you're savvy and can take advantage of them, they can be really wonderful. You can go online and you can get tours of museums. I just saw the other day, you can sign up and do an African safari online. There are opportunities to watch old movies, to watch reruns of television shows, exercise shows. For those individuals, it's very possible to stay stimulated through reading, through email. But for individuals who are really relying on others to provide group activities, it's been a real challenge.
Okay, and then, that's a great point in the sense of, it sounds like it's all coming back to technology a little bit, which has been a great useful tool in this pandemic. I want to talk to you about the caregivers, though. Mentally, what are some of the challenges they're facing? I know you specialize in mental health in general, but let's talk about those who are taking care of seniors in our geriatric population.
Well, caregiving has been recognized for a long time as being, first of all, highly valued, necessary. Most of our seniors are being cared for by what we call informal caregivers, meaning family caregivers, who have been shouldering the burden of care even before the pandemic. And it's a tough job. It's an exhausting job. It can be a rewarding job to be there for your loved one and to be able to provide that day-to-day care, but it's really challenging, very tough. And it is tougher now. It's tougher because the kinds of other outlets that people have relied on aren't as available. Senior centers, medical daycare programs where family members may have spent part of the day, 5 days a week, a few days a week, are no longer available. They were wonderful outlets, great for the older adult, great for families. The opportunities to have some respite are much more narrowed. And those families that can afford it and are having aides and assistants come in the home have the additional stress and worry. Well, will that individual who comes in my home bring the virus? Are they going to get sick? Will they not be able to come? So it's really stressful. And for those caregivers who are, I think most family caregivers are finding that they are providing more care, more of the day, more days of the week, and it's not easy for them.
Are we seeing a divide when it comes to socioeconomic class in this pandemic with mental health, just like we've seen with the physical health side?
I think we definitely are, Sabirah. I mean, we're seeing it at all ages, and we're seeing it with our seniors as well. That those who don't have technology, don't have access to the internet, are often from more socioeconomically deprived neighborhoods as well, and it's a lot tougher for them, and they have those fewer options. I will say that another boon, really, of our current times is really telemedicine. We haven't really talked about that. And telemedicine is something that is amazing to me because as a geriatric psychiatrist, my field has been wishing for this For years. We've known there have been studies even years ago showing that telemedicine can be really effective to stay in touch with doctors and for doctors to stay in touch with their patients. But one of the silver linings of the pandemic is that we are now able to do it, and that Medicare is approving it for telehealth visits. And in fact, our whole clinic has transitioned 100% to telehealth visits since March. Now, that has included telephone visits for those who don't have a smartphone, who can't do FaceTime, who can't do a Zoom appointment or a video appointment. But it has been a real boon to be able to stay connected with patients, to be able to provide care. And I would encourage both, caregivers for themselves and for their loved ones to take advantage of opportunities to stay connected with their doctors and their therapists through telemedicine and telehealth.
So this can be a great resource to get the help you need and stay connected in a sense as well when we're talking about the mental health services like therapy and other treatments like that.
Absolutely, absolutely. And I think I will also say one group that tends to not prioritize their health enough are our caregivers. Even before the pandemic, we know that family caregivers often were taking care of their loved one and putting their own needs further down on the priority list. Particularly during this pandemic, it's important, don't ignore your own health needs. And be sure that you connect with your own doctor via telehealth to be sure that you're taking your medications and that you're taking good care of your own health, so you're there for your loved one.
Before we start wrapping this up, I know you're a very busy woman. Let's talk a little bit about some of the warning signs for people who may be unfamiliar with this space. Talk about some of the things we can do to help our elderly population and our seniors when it comes to noticing that something's different.
Okay. Well, I think from a mental health standpoint, the things that I'm noticing the most really are anxiety and maybe sadness and depression. In terms of anxiety, the first thing that I usually say to people is, I think some feelings of anxiety are understandable and normal. We're all anxious about this. I think we live through stressful times. And so to realize that some of this is not necessarily pathological is important. But if anxiety gets to the point that it's affecting sleep, it's affecting your functioning, and you're finding you can't distract yourself and enjoy the avenues that are open to you, well, then that's becoming a problem. And so among the things that I've recommended are to cut back on your dose of news. We live in a 24/7 news world where sometimes the news is just gets repetitive, redundant, and maybe is more than you need to hear. And to focus on ways of maintaining your good mental health, which is really maintaining good physical health. And that's ensuring you get a good night's sleep. Don't neglect the importance of good nutrition, eating 3 good meals a day. Finding the opportunity for exercise, which walking is sufficient. When the weather allows for it, walk outdoors with a mask, of course, and keeping 6 feet away from other people. But getting exercise, good nutrition, and sleep, they sound so simple, but they actually are accessible to all of us, and they really are enormously effective in maintaining a good mental health. When it comes to sadness and depression, I have to also mention this is, even without a pandemic, this is the time of year that those of us, in psychiatry worry about. Because many people, even before the pandemic, noticed that in the fall and the early winter, they might tend to get a little bit of blues, the holiday blues, and the change in seasons. For some people, they have what we call seasonal affective disorder, where they tend to get a little sadder, and this time of year is tough for them. Again, for these individuals, I think it's for everyone. I want to emphasize the importance of sleep, exercise, and nutrition. It's going a long way. And keeping yourself active with a routine and a schedule is really important to fighting this kind of seasonal sadness and depression. If you're to find that you're really unable to fall asleep, you're unable to stay asleep, you wake up too early in the morning, you're losing your appetite for food, you're finding it's difficult to enjoy things that you can enjoy, then do talk to your doctor and get screened for a possibility that you might have depression that might need more specific treatment.
That is great information. Once again, Dr. Lehmann says if you're noticing a change in your sleeping habits, eating patterns, eating habits, a lack of desire to do activities you normally were really excited about in the past, could be signs. We're saying could be signs for a potential mental health issue, maybe even depression. Dr. Lehmann, give us a little preview as to what you're working on, some of the important topics you're going to be looking into as we continue down this pandemic and making it through 2020. What are some things that you're looking ahead to in your research?
Well, I have to say, while we're very much focused at what the problems are, I think we need to be focused on how do we really help people. And a very interesting area that's really starting to get more attention is a concept of how do we build and cultivate resilience? How do we help people of all ages, and especially our seniors, be able to have the inner resources to be able to handle stressful things like a pandemic or something else that may happen. And so, as I mentioned earlier, some individuals are coping better with COVID-19 than others. What can we learn from them? What about them, about their personality or their habits, can we use and help to train and teach other people to be able to do? Because quite honestly, I'm sure that this pandemic will come to an end with vaccines. We're seeing the light at the end of the tunnel, but life is uncertain. Our present day world is uncertain, as we know, and there may be other challenges in the future. So I think this pandemic is also providing a great opportunity to really think proactively. Are there ways that we can help our seniors have a higher sense of resilience to weather life events, personal events, or ones that are happening in the country, whether they are, whenever they might in the future experience stress and uncertainty due to any kind of cause. And so that's just something that I'm particularly interested in as well.
Well, Dr. Susan Lehmann, thank you so much for taking time out of your very busy schedule at Johns Hopkins University to join us live on Facebook for our audience. Now, if you have any additional questions or you want to hear more from Dr. Susan Lehmann, you can sign up for a free virtual Zoom session with Dr. Lehmann, and that's the Ruth and Norman Relish Jewish Family Services right here in Boca Raton. The event will be virtual and it is free. We have the information on our website, wptv.com. Dr. Susan Lehmann, thank you so much for your time. You are truly wonderful and keep helping people. Thank you. Thank you.
Thank you so much for having me. Thank you so much. It's been a pleasure.